In this video, we will discuss how to identify adolescents who need intervention using an SBIRT algorithm developed by Children's Hospital in Boston that incorporates the CRAFT screening tool. The algorithm begins with 3 opening questions that are answered by all adolescents. During the past 12 months, did you drink any alcohol, more than a few sips, smoke any marijuana or hashish, use anything else to get high? Anything else includes illegal drugs, over-the-counter and prescription drugs, and things that you sniff or huff. If the teen answers no to all 3 opening questions, ask only the first CRAFT question. Have you ever ridden in a car driven by someone, including yourself, who was high or had been using alcohol or drugs? If the adolescent answers no to all 3 opening questions, but yes to the car question, the provider should briefly counsel the adolescent about the dangers of riding in a car with someone who has been using alcohol or drugs. If the adolescent answers yes to any of the 3 opening questions, proceed with the full CRAFT screen. CRAFT is a mnemonic acronym of the first letters of keywords in the 6 screening questions. The questions should be asked exactly as written. If the adolescent answers yes to 1 or more opening questions and the CRAFT score is 2 or more, the teen may have a serious substance abuse disorder. They should be assessed for signs of addiction or risky behaviors such as drug-related hospital visits, driving after substance use, etc. Teens who show no signs of risky behavior or addiction should have a brief intervention. One approach to a brief intervention uses the acronym FLOW. Provide feedback from the CRAFT screening tool, ask patients for their views about their own substance use, and listen to encourage their thinking and decision-making process. Provide medical advice and negotiate a decision about options the patient can pursue. This 5-minute brief intervention should lead to establishing a goal, developing an action plan, and negotiating follow-up for motivational interviewing with the physician, nurse practitioner, nurse, or in-office behavior counselor. A motivational interview is a 15 to 30-minute billable session. The Health Education Alliance of Maine, in collaboration with Massachusetts General Hospital, developed an online course to support motivational interviewing in primary care offices. This course can be accessed at the URL indicated on the screen. A quick overview is presented here.
Welcome to this enduring material on motivational interviewing. For your convenience, this presentation has been split into 2 activities, each worth 0.5 AMA PRA Category 1 credits for physicians. Credits are also available for psychologists, nurses, and social workers. The first activity, which is entitled Introduction to Motivational Interviewing, is an overview of the motivational interviewing techniques and their implementation. Healthcare workers will find this activity beneficial for a brief overview of motivational interviewing, especially if you don't know basic skills and techniques. The second activity, tobacco cessation and medical adherence, consists of clinical role plays demonstrating the motivational interviewing techniques applied in practice. It has both traditional interviewing techniques and the new motivational interviewing techniques, so you can contrast between the 2. This activity is best used to help build or develop knowledge on motivational interviewing. Participants can claim credits for the activities individually for 0.5 AMA PRA Category 1 credits, or together for a total of 1 AMA PRA Category 1 credit.
The 2 patients featured in the motivational interviewing course are not adolescents and do not have a substance abuse problem. However, the motivational interviewing approach is generalizable and of value in the primary care office when supporting patients who want to change health behaviors. An important first step in the motivational interviewing process is to assess the patient's readiness to change. Recognizing where the patient falls on this continuum suggests the approach the practitioner should take in the motivational interviewing session. In the pre-contemplation phase, the patient has not recognized that he or she has a problem and has not thought about changing. The practitioner's role is to raise doubt in the patient's mind. In the contemplation stage, the patient is ambivalent. He or she is not yet ready to change, but recognizes that there may be a reason to change. The practitioner's role is to reinforce this ambivalence and to further develop the discrepancy between what is desirable and what is undesirable about the behavior in the patient's mind. Encouraging the patient to discuss what is bad and good about the behavior supports his or her progression to the next stage of readiness for change. The extent to which the provider will engage with the adolescent in motivational interviewing will vary. Adolescents who show signs of risky behaviors or for whom addiction is likely will need referral for substance abuse treatment. Check your understanding by taking the following quiz. Listen to each question, pause the video, and select your answer. Then listen to see if you are correct. Individuals identified to be at-risk users are at increased risk for A. Adverse medical consequences, B. Interpersonal problems, C. Injury, D. All of the above. The correct answer is D. Individuals in the pre-contemplation or contemplation stage are prepared to change their behavior. True or false? The correct answer is false.